Hello, and welcome. Today, we're delving into the intricate world of neurological disorders to explore slow-channel congenital myasthenic syndrome, or SCCS. This rare genetic neuromuscular disease impacts the communication between nerves and muscles, leading to weakness and fatigue. Join us as we unravel the complexities of SCCS from its origins to its management. SCCS is primarily caused by genetic mutations. These mutations occur in genes responsible for building the acetylcholine receptor, a critical protein located on the muscle cell. This receptor acts as a gateway receiving chemical signals, specifically acetylcholine, released by nerve cells. Mutations disrupt the normal function of the acetylcholine receptor, leading to prolonged activation and muscle weakness. The pathophysiology of SCCS centers around the dysfunctional acetylcholine receptor. Because of the genetic mutations, the receptor remains open for a longer than normal duration after acetylcholine binds to it. This prolonged opening allows excessive flow of positive ions, primarily calcium, into the muscle cell. This excess influx causes the muscle cell to become overexcited and eventually desensitized to further stimulation. The prolonged exposure to acetylcholine also damages the end plate region of the muscle, further impairing nerve-muscle communication and causing muscle weakness. SCCS is a rare condition. Exact epidemiological data is limited due to its rarity and potential for misdiagnosis. However, it is believed to affect a small number of individuals worldwide. It typically presents in infancy or early childhood, although later onset cases have been reported. Because it's a genetic condition, it affects both males and females equally. The hallmark of SCCS is muscle weakness, which fluctuates in severity. Infants may present with floppiness, feeding difficulties, and breathing problems. Older children and adults experience fatigue and weakness that worsens with activity and improves with rest. Specific symptoms can include drooping eyelids or ptosis, double vision, known as diplopia, difficulty swallowing, or dysphagia, and weakness in the limb and neck muscles. Some individuals may also experience episodes of respiratory distress. Diagnosing SCCS requires a comprehensive approach. Physicians will typically start with a thorough clinical evaluation, assessing the patient's medical history, and performing a neurological examination. Genetic testing is crucial to identify the specific mutations in genes associated with SCCS. Electrophysiological studies, such as repetitive nerve stimulation and single-fiber electromyography, can help assess the function of the neuromuscular junction and support the diagnosis. Antibody testing, typically used for acquired myasthenia gravis, is negative in SCCS. While there are no universally agreed upon classifications for SCCS, it is often categorized based on the specific gene mutation causing the condition and the severity of symptoms. Different mutations can lead to varying degrees of receptor dysfunction and clinical presentations. Some mutations result in more severe, early-onset symptoms, while others may lead to milder, later-onset disease. Currently, there's no cure for SCCS, so treatment focuses on managing symptoms and improving quality of life. Medications such as quinidine or fluoxetine can sometimes help to shorten the opening time of the acetylcholine receptor. 3D4-deaminopyridine, a medication that helps increase the amount of acetylcholine released, can be harmful. Physical therapy and occupational therapy play a crucial role in maintaining muscle strength and preventing contractures. In severe cases, respiratory support, such as mechanical ventilation, may be necessary. As SCCS is a genetic condition, there are no preventative measures an individual can take to avoid developing it. However, genetic counseling is essential for families with a history of the disorder. Genetic testing can identify carriers of the mutated genes and provide information about the risk of passing the condition on to future generations. Early diagnosis and management can help to minimize complications and improve long-term outcomes. The prognosis for individuals with SCCS varies depending on the severity of the condition and the specific genetic mutation. Some individuals experience mild symptoms that can be effectively managed with medication and therapy, allowing them to lead relatively normal lives. Others may have more severe symptoms that require ongoing medical care and respiratory support. Research is ongoing to better understand the underlying mechanisms of SCCS and to develop new and more effective treatments. Gene therapy and other novel approaches hold promise for the future treatment of this challenging condition. Scientists are working towards treatments that target the dysfunctional acetylcholine receptor, aiming to restore normal nerve-muscle communication.